I just want to remind everyone that this webinar is being recorded, and we're referencing the new publication of Reopening and Reentry, a guide for New York Jewish organizations, and the presentation as well. Both are going to be available at www.jcrc-ny.org/reopening. So please, if you miss any part of this, or if there's anybody else you believe needs to see this presentation or have the guide, you see it on your screen now, you can please click on that link, and you will find the presentation as well as the guide itself. And we just want to remind everyone to please post their questions in the chat box. I hope everybody is well, and I hope everybody is being as productive as we can be during these very challenging times. Since its inception, JCRC-NY has been New York's Jewish community's lead agency in the security and emergency management arena, working with federal, state, and local agencies. We always knew that we should be offering more to the Jewish community, and this year we were able to create the Community Security Initiative, which is a joint program with UJA Federation. Working, planning, and visioning together with UJA for nearly a year, the Community Security Initiative, CSI, was created. To be honest, we never conceived a pandemic shutdown of our institutions. But as reality set in, we realized that there will be light at the end of the tunnel. After the shutdown, there will be a reopening. Our talented Community Security Initiative staff began collecting best practices so that organizations, Jewish and beyond, can safely reopen. Today, we're engaging in an effort to educate organizations, and the group today is mostly consisting of Jewish Community Center professionals. We learned that reopening is much more than just unlocking the door. Underused buildings might not be healthy environments, and we have to protect the health of our clergy, our staff, our congregants, our members, our visitors, whoever they may be in Jewish institutions. And yes, we will still have the old security concerns as well as some new ones. We very much want to thank Governor Cuomo, Andrew Cuomo, for his leadership during this entire process, and to thank Michael Snow, who is the Director of Jewish Affairs for the governor, who unfortunately could not be here with us. But our partnership with the governor's office is a very important part of what CSI engages in. Obviously, we also want to thank UJA Federation, because there wouldn't be a CSI without UJA. And without further ado, I want to introduce Abby Knopp, Managing Director of UJA's Network Department, who will share some of UJA Federation's extraordinary initiatives to support us during these challenging times. Abby?
Is that what I'm doing, Michael? I actually thought I was doing what you just did. So I'll just thank you for your intro, and I think you pretty much covered it. I do want to introduce myself, and I see that not everybody on the phone on the list of participants are people that I know. So as Michael mentioned, I'm Abby Knopp. I've been in my role for about 15 months, and have had the pleasure of working with Michael and the JCRC on a variety of different initiatives and traveling with them to Israel. So I think what I wanted to just mention, as most on the call know, we've allocated more than $46 million so far. A big chunk of that came from our endowment to support ongoing needs in this moment in time. And I want to just highlight one other thing that the network department is doing before I turn this back over to the JCRC. Which is to say that we are announcing a new collaboration of UJA with the Robin Hood Foundation and the New York Community Trust, who will be, all of us are working together to provide a package of capacity building resources in the coming months. The resources will focus on training, and consultative support in critical operational areas, including human resources and employment law, scenario planning, financial management, fundraising, executive coaching, and governance, all in relation to the realities that we all of you are facing and all of us are facing in this moment. So if you want more information on that program, please reach out to Jill Mendelson. Some of you may have already received an email from her, and we will send her email address and her contact information after. And I think, Michael, I'm turning it back to you to introduce Mitch, or? Yeah, great.
Okay. Thanks so much, Abby. You're a terrific friend, and great to be working together with you on so many different projects. And happy that you're on the call today. It's now my pleasure to introduce the Executive Director of the Community Security Initiative of CSI, Mitch Silber. And just very briefly, Mitch is a professional global risk intelligence and security analyst. He's the former director of intelligence analysis at the New York Police Department at NYPD. He holds a master's degree from Columbia University's School of International and Public Affairs. And together with David Pollack, they make a very, very dynamic duo, David serving as chair of CSI. But we're going to start with our executive director, Mitch Silber. Mitch?
Thanks so much, Michael. I'm going to play the all-important role of pointing your attention to our disclaimer. As you know, it's a very fluid and dynamic situation. The guidance that we're getting from Albany, from City Hall, from CDC is constantly changing as the environment changes. So the guide and our presentation today will adjust. So we hope that you bear with us as we have flexibility here. The next thing I'd like to do is walk you through what we're going to be doing today. First, I'm going to be introducing what is the Community Security Initiative. Many of you have learned about this through our rollouts in the different geographies, but I'll just do a quick refresher and introduce you to the team members in case you're unfamiliar with them. We'll go over what is the process for reopening specific to your institutions. We'll talk about some of the human resources and legal concerns, and we're glad to be joined by the General Counsel for JCRC, Marcia Eisenberg, who will be covering that. We'll be talking about safety and security, and one of our regional security managers, Bill Hayes, is going to be walking you through those issues, as well as the special considerations that we understand that community centers need to deal with. And then finally, we'll have Q&A afterward, and we're going to encourage you to use the chat feature for that. And now just to introduce our team. As you heard, our chairman, David Pollack, leads the effort. I'm the executive director. Today, you're going to be hearing from Bill Hayes, who is the former police chief in Bedford and is our Westchester and Bronx regional security manager. He has a specialty in preventing and training against active shooter events for Manhattan and Staten Island. Terry Byrne is our regional security manager. He's a former lieutenant at NYPD and worked closely with me in the intelligence division for a number of years. Subsequently, he went to the U.S. Marshals Service to protect the Southern District in New York. In Brooklyn, we have Adam Barish, who served as the liaison to the Jewish community for 3 different police commissioners and knows Brooklyn inside and out. For Long Island, Nassau, and Suffolk, we have Laurent Filibi, who joined us after 20 plus years in the Shin Bet, the Israeli security agency, sort of like the FBI plus. He also worked for El Al. And last but not least, Seth Goodstein, who is a retired lieutenant from NYPD, more than 20 plus years on the job, and also ran security for Marriott hotels here in the city, some of their high profile locations, and very active in Jewish organizational life in the Shomrim Society and Federation of Jewish Men's Clubs. So with that, I'm going to hand things over to Bill Hayes.
Thanks, Mitch. Good morning, everybody. We're going to go through some important information as you approach reopening. We're all in different phases in the New York metropolitan area. A lot of these decisions are they're rolling along, and they change over the course of time as new information is obtained. New York City just entered phase 1. Hudson Valley went into phase 2 yesterday. Long Island, I believe, is going into phase 2 today. So all of the stuff that we're going to talk about today is fluid. These are things that will continue to evolve as we recover and move back towards some semblance of normal following the arrival of Corona. Now, there are some important things to remember. All of our information, our direction comes from New York State, local officials, county government, local governments, as to when each phase will begin. Community centers are likely to be in phase 4, but we should always be paying attention to the governor and other official sources to make sure that that's still on track. New York's going to base its reopening criteria on CDC guidelines, and there will be guidance provided throughout each phase for institutions, and we're going to work hard to make sure that we get that information to you as we learn it. So for today, what we're going to be discussing is opening or reopening your physical building and your facilities and how you might go about welcoming back your stakeholders. And we recognize here throughout this crisis that a lot of you have remained open in a different fashion than you normally are by providing essential services, virtual options for some of your services, meetings, and other needs of your stakeholders. So as we go through the presentation, understand from our perspective, we know you've been working hard all through this crisis in order to be there for your stakeholders. Now, this slide is an interesting graphic. I think it's important because it illustrates just how much there is to do. When you reopen your institution, it's not as simple as unlocking the door, turning the lights on, and picking up where you left off. If you look at this list, look at, and this is illustrative from the conference board, current statistics on the things that are going on in corporate America and where the focus is in terms of getting facilities prepared, timing, health and safety issues for employees as well as the public, and look at the various tasks that are listed here. And the percentages are interesting, but it's really important, I think, to look and identify how many things go into resuming some level of service, and you can't just flip a switch. Next slide, please. So early on, as you start thinking about reopening, you want to build a team. These decisions shouldn't be made in a vacuum, because there's a huge knowledge base at your disposal in your facility with your staff, your volunteers. The more diverse your reopening team is, the better outcomes you're going to have. So while acknowledging that there's a lot to do, look at the big picture and recruit the team and focus on preparation as being the key to your success. The more you do ahead of time, the more successful you'll be with your implementation. Just because the government says green light, go, make sure you're ready before you kind of, excuse the phrase, pull the trigger on opening up. Make sure that you've taken the time to prepare. And I always use the phrase, just because you can doesn't mean you must. Open and resume operations at a speed and a pace that's comfortable to you and your community. It's very, very easy to get overwhelmed by the planning process and by the reopening process. Just that graphic alone is enough to say, you know, to cause anxiety looking at the list of things you have to consider. And that's why the guidance that you'll hear from us today, as well as the JCRC's reopening guide, is really important. And again, to reiterate, staying in touch and paying attention to government direction is so important. And back to the team. In terms of your team, you want to look for team members that bring expertise in various skill sets: building maintenance, human resources policy, finance, security, and so on and so forth. By having as many of these areas covered on your team, you're going to be better equipped to reopen in a safe and effective manner, and your level of decision making is going to be better. The team itself should be empowered to identify issues, identify options to resolve those issues, make recommendations, and then finally to implement them. Every person on the team should have specific responsibilities, and they should be designated and communicated. For instance, who in the organization is going to notify government agencies if an employee, a volunteer, or a congregant tests positive for COVID-19? Who's going to be the chief safety officer? Who's going to monitor and check whether the appropriate measures are being implemented before reopening? Who's going to oversee this overall effort? And who's going to continue to assess this process over time as you proceed with your reopening? Is this going to be the security committee? Is it going to be the executive director or some other staff members? And we know in a lot of organizations, these are volunteer positions. And I'll bet you many of you out there today on this call are wearing multiple hats. You might be serving as an in an executive position while at the same time being on a committee or a committee chair. And there's a lot to that. So it's important to recognize that when you're using volunteers, it's difficult to have them take on these roles. And you may have to have team members take on more than one responsibility or have backups in each role. It's not an ideal situation. We know that, but this is not an ideal environment that we're working in. There's a lot of new things that none of us have experienced before. So it's imperative that you have all these positions covered and try to the extent that you can think of any contingencies or anticipate any contingencies. Try to make sure you have the proper amount of people to coordinate this reopening process. And that's why preparation is important. And again, the old phrase, too many cooks can spoil the broth. You don't want too many people involved in the process, but you want to make sure you have enough depth on your bench so that you can cover all possible contingencies and not have any gaps in coordinating your plan. Speaking of plans, your plan should be flexible. They're always going to be subject to change. Even this document that we're rolling out with you today is a living, breathing document. We're going to continue to edit and keep it updated to stay current. And that's going to be based on what's going on with the infection rate, what's going on with government directives. And keep in mind that down the road, as we're preparing to reopen, we have to consider the fact that we may have to close again. So these plans have to include now, while we're talking about reopening, what will we do if another outbreak occurs and we receive direction that now we've got to reduce our staffing, reduce the amount of public citizens that are allowed into our facilities. So make sure you're thinking about these things far in advance. Don't wait for something to happen before you consider how to take care of whatever that problem is. Next slide, please. So the building, the physical plan, the reopening process is multifaceted. There's HR issues that Marcia's going to talk about. And then we have to talk about the physical plant. That building itself needs to be ready before it's occupied. There are going to be new security challenges in addition to the old ones that we always had to deal with. And you're going to constantly have, you're always going to have to be in a position where you're able to adapt. Think about it. Your building has been underutilized or idle or maybe completely unoccupied for a number of months. All kinds of things could be going on inside your building. Contaminants might be flourishing in your absence. And I'm not necessarily limiting that conversation to COVID. What about your HVAC system? Has it been run? Is your plumbing up to snuff? So you should have somebody checking your building systems and having the premises thoroughly cleaned before anybody occupies it. Things like the water system should be flushed. A complete sanitizing of all surfaces should take place to make sure that there aren't any contaminants in the environment. And this is going to give peace of mind to not only your members, but your staff, your visitors as well. Knowing that these things have taken place before anybody comes into the building is going to be important in terms of making everybody feel safe and comfortable. So on security, none of the old stuff we had to worry about has gone away, but now there are new challenges that have to do specifically with COVID and this reopening process. We're going to get into it a little bit more in depth later, but just keep in mind, just like we've been staying at home, so have the bad guys, so have the people looking to do harm. And as we emerge out into the world, so will they. And we want to make sure that this doesn't present an opportunity for anybody looking to perform criminal acts. So you should be developing processes to ensure ongoing compliance with entry monitoring, social distancing, and cleaning. These are big challenges. It's too easy to become complacent in this area. As we start these processes and everybody stays healthy, it's easy to get a false sense of security. It's easy to let our guard down. And once you start relaxing safety measures, and that's universal, that refers to health safety as well as physical security. Once you get complacent in those areas, it's possible to have an increased chance that someone can become ill or that you could have some kind of security issue. So I can't say it enough. We're in a rapidly changing environment. The only certainty is that these rules are going to change. So keep in touch and regularly check the applicable federal, state, local websites for updates. And of course, you can always contact us at CSI, any of the regional security managers or the management staff. We're always available to assist in any way we can. And of course, the reopening guide should be a resource at your fingertips as you proceed through these various steps. Next slide, please. So now it's important to bear in mind that JCCs are employers. They're multifaceted. They're service organizations, they're employers, they're places of public assembly. You have things going on. You have staff obviously coming and going, clients, deliveries, and public events that might be open to the general public. So you need to be concerned with all these different facets of the reopening safety standards. Communication is key. In the absence of communication, rumors flourish, so it's important that all your stakeholders receive current and up-to-date information as soon as you have it. And I always think it's a good practice that if you don't know something, rather than be silent on an issue, acknowledge that you don't know and you're seeking the answers. It's still better than not communicating. Even a answered is better than no communication at all. Excuse me. What this is going to send to your stakeholders is a message that you care, you're paying attention, and your new practices and protocols will reflect that message. Excuse me. It's important to let people know about any changes and why you're making those changes. And again, by keeping everybody in the know, you're able to minimize conflicts and confusion. Be prepared to continue a lot of your activities online. One of the benefits of this crisis is we've learned how to move a lot of what we do online, and in some cases we were doing that very successfully. Limiting face-to-face interactions is still going to be a fact of life. You're going to be opening, but perhaps operating at a reduced capacity, or there are going to be folks that just aren't comfortable or maybe in a high-risk group that can't come out yet. So limiting the face-to-face interactions to the degree that you have to is going to reduce the chance of infections. And because of this so-called second order consequence, that's a bit of a benefit, is that these remote conferences, just like we're doing here today, have been effective. And in a lot of times, we're seeing increased participation because the video conferences are easier to access than having to travel to a physical location. You're still going to be living in a world where masks and social distancing measures will likely be with us. You're going to have to look for creative ways to accommodate people that want to attend services or use your facility, and prepare for the fact that people will be disappointed if they can't attend in person. If the capacity is limited and someone does not get to attend because of capacity issues, there's the potential for hurt feelings. So if you communicate clearly and in your actions and words, treat everybody fairly, it's going to go a long way towards furthering understanding. People won't have their feelings hurt. They won't feel left out if you're being fair. We also get a lot of questions about how a center, a community center, or even a house of worship can be articulated this way. Warm and welcoming at one point meant being free and open. There's a lot of things that happened in the world that preceded COVID that made us think more about safety and security in tandem with these other things. And now warm and welcoming also includes safety and health. We can't feel warm, we can't feel welcome in a place that we're concerned about getting sick or having some kind of security violation. So putting health concerns, health safety and health security into the mix is not a bad thing. It goes a long way towards maintaining the desired paradigm of having your facility welcoming and open to anybody. Next slide, please. So back to the team. One of the jobs of the team is going to be to identify the key facility challenges for your facility while keeping in compliance with all of the local requirements. You're going to have to acquire, excuse me, resources. You're going to have to make policy changes so that you can reopen while protecting the vulnerable. Marsha's going to get more into the HR piece, but I'm going to speak a little bit now about PPE, personal protective equipment, masks. Do you have the material that you need to open on hand? And do you have a supply chain available to you so that you can maintain adequate stock? This is important to know and to ensure that these things are taken care of prior to opening. What are the duties and responsibilities going to be for your facility in terms of cooperating with contact tracing efforts? Are you going to have to take attendance? Are you going to have to take temperatures of everybody entering your facility? Will people come with their own masks? And what will you do if they don't? You should have or consider having your own supply of masks on hand to give to those that don't have their own. That's going to go a long way to reducing the inconvenience and any potential conflict, which brings up another point. Have a plan in place to handle how you will handle a situation where someone tries to enter your facility but refuses to comply and refuses to cover their face with a mask. Now, in the past week or so, the governor issued an order that permits businesses to refuse entry to anyone who won't wear a mask, and that's to your benefit because it gives you that authority to do so. But you also want to maintain, again, the warm and positive relationships you've had all along. So this type of activity has to be done tactfully and in a way that doesn't do unnecessary harm to the relationships that you have. So again, back to supply chain. Will you be able to find a supplier? Do you have a current supplier? I know that there are buying groups being put together out there, consortiums to get supplies. Do you have or know about what disinfectants are appropriate for this job? A lot of the stuff has been difficult to maintain, at least early in the crisis, but we're getting reports that in recent weeks it's starting to become more readily available, but that's something you really need to pay attention to. Also, follow government guidelines for cleaning and disinfecting. The building, as I mentioned before, has been underutilized for a long time. Make sure that there are no contaminants residing on surfaces. And even the guidance with regards to surfaces. In the beginning, it was thought that the COVID virus could last a long time on a surface. We paid a lot of attention to cleaning touch points, and now there's been some walk back of that maybe surface contamination isn't our #1 concern. And this will change yet again, I'm sure, as the science community gets more information. So also security. Keep in mind that the security role and the security personnel will most likely be taking on new duties, new roles, such as maintaining contact tracing lists, taking a temperature, taking attendance. And if this is the type of thing you're going to implement, if security personnel are the ones you select to do this, remember that they should be trained in how to properly do it. Your policy should cover how you want them to do it in terms of your institutional rules. And also remember that if security officers and security personnel are taking on additional duties, such as temperature checks, it's going to divert their attention away from traditional security work, which still has to be done, and that may impact your staffing decisions. Next slide, please. So the word of the day is adapt. You have to maintain the ability to adapt as we transition from what we're now calling the old way into the new way. And who knows what the new way is going to finally look like. Maybe there won't be a final new way. We're going to continue to have to adapt. So determining certain things that are on this list, like what needs to be cleaned, how are you going to do that, what you're going to do it with. Things like ventilation are important. We're learning that opening windows, having fresh air exchange and circulation is a good thing when it comes to preventing the virus. Again, with the CDC recommendations on surfaces has changed quite a bit. Normal routine with soap and water, at least, is a good effort in removing germs and dirt from surfaces. So a lot of attention should be paid to maintaining the cleanliness and sanitation of the facility. You're lowering risks. Disinfectants kills germs on surfaces. Anything you can do to reduce the exposure risk is a good thing. Next slide, please. Communication is key. I mentioned that earlier. Unclear information leads to rumors and misinformation. How will you communicate within your facility once you reoccupy it? You can get a sore throat really quick if you have to constantly give the same messages verbally. There's a lot going on in terms of signage, and you'll see signage recommendations in a lot of the literature that refers to reopening. How will you communicate in a way that's clear, that's friendly, and constant and ubiquitous and always there without having to be dependent on a person or people to give messages? A great way to do this is by having effective signage at your entrances. It's your place and these are your rules, and if you communicate them, there won't be any misunderstandings. If you have signs inside the office or in staff areas, then you're constantly reminding your staff how important the message is, how important it is to prevent the spread of COVID, and also equally important, or maybe even more importantly, how much you care about their health and safety. Signs at the entrance can remind those entering of symptoms, what to watch out for, and a reminder that nobody should be coming into the facility if they're feeling sick or displaying any of the symptoms. Signs are also fair. It can give advance notice of what to expect before being admitted into a facility, like health screening, temperature checks, mask requirements, attendance requirements, and so on and so forth. For employees, signs in the break room can help remind people to wipe down commonly touched surfaces, whether it's the handle of the coffee pot or the microwave or whatever it is that's relevant before anybody else touches those things. Signage can be used to delineate space, social distancing, pathways to enter and exit the facility. Signs in bathrooms for years have reminded us to wash our hands before returning to work. This is just an extension of that same concept in a more broader fashion. And remember, all these messages help reinforce to the reader the fact that you care about their well-being, whether they're staff members, visitors, or regular clients. Next slide, please. Timing. Your capacity is probably going to be required to be limited. You're not going to go back to the same old paradigm. So how do you do that? Do you stagger hours? Do you make a reservation system for, let's say, gym facilities or pools when they open? Continuing online activities so that you can disperse and spread out the amount of people and how they're accessing your services. It's important to maintain that sense of community, that sense of spirit, and stay connected. You're not going to be able to use your facilities like you were in the past. You're not going to be able to use all of your equipment at the same time. So reservation systems, and then concurrent with that is staff scheduling. How will staff scheduling have to be adjusted to accommodate your new scheduling paradigm? So that's all I have in this segment. I'm going to be talking later on in this program about security, but for the moment, I'd like to introduce Marcia Eisenberg, who is General Counsel for the JCRC of New York, and also the Director of Legal Assistance for Jewish Organizations. And Marcia is going to discuss legal and human resources concerns for the next few minutes.
Thank you, Bill, for that wonderful overview and the important details that we all need to keep in mind when we're planning and figuring out how to open up. I'm going to be covering, not in depth, some of the legal issues that we all need to consider. The first one that I want everyone to be aware of is that there is a legal requirement by all levels of government that employers have to have a duty to provide employees with a safe workplace free from known hazards. Obviously, this includes COVID-19. Second, complying with this duty of care for employees will be helpful and for you to determine some of the other policies and procedures that you need to have in place for your other stakeholders. Next slide, please. Okay. The 2 points I want to make here is that there has been some federal and state legislation which is not going anywhere so fast to try to shield businesses for COVID-19 exposure liability. And there's also been some lawsuits. I'm not trying to scare you, but that is the reality. But what I want you to think about is before you make plans or while you're making plans to open up, check in with the legal counsel on your specific human resources matters for your employees and your stakeholders. And since there are multiple levels of laws, it might be helpful in terms of juggling what you have to do first and how it all goes together. The other thing that might be practical is to try to find through your broker a risk manager at your insurer to have them go over what your plans are and help if they have any other ideas that would be good for you to incorporate into your plan. It's okay. Next slide. Okay. Human resources considerations. Bill has already talked about this, especially at the JCCs and the Ys. You have many stakeholders. You have the staff, you have your board members, you have members of the organization, there's clients, there's volunteers, there's parents, there's students, it just goes on, visitors, etc. So you need to think about all of those kinds of different stakeholders and how they go in and out and what kind of policies that you should have to keep them all safe. And if you think about that and you try to put those all together and communicate that to all of your stakeholders, they will hopefully understand that you're developing safety policies and procedures and doing changes physically in your space that will be helpful for you to open up and comply and make everyone safe and healthy. And you need to communicate this frequently to all of them so that they know what's happening. Next slide. Oh, no, not next slide. The other thing that you need to deal with, it's actually, it doesn't matter, is that employees are special. And if you don't have a sick leave policy or a policy requiring that if someone is sick, they should not come to work, you could have some employees come in who are mildly symptomatic and show up for work, which of course is not a very good part of your plan. And it creates obviously very unnecessary exposure to COVID-19. And that's a safety problem for all of your stakeholders, not just the employees. You should be aware that if you don't have a leave policy, this is the time to put one together. And also remember, you're not in it alone. There is United States has changed a lot of its laws, and New York State has also changed some of the leave laws that they have, and all of them are meant to work with an individual organization's policies. It's really, I'm not going to go into great detail. There's all the different acts that have come into play. And most of them are all focused on all the different things that could go wrong during COVID-19 for an employee. Being sick, being quarantined, having kids at home, taking care of someone else who's sick, etc. And I'm making it simple, but there is a lot there, and there is places for you to go to get the coverage for your employees, along with whatever you have put together in your policy. The other, that's really all I wanted to talk about now on that one. The next slide, please. Okay. This is also talking about some of the things that Bill talked about. You really have to, it's not just a plan and you put it aside and put it up and that's that. This is, again, ongoing. You have to not only be ready to open up according to New York State laws and guidelines, and there's a whole form and there's a bunch of things you have to file and say that you've read and you've complied with, but you have to be ready for things to change on a dime. So you need to continue to plan and think about possibilities. In order to prevent infection, a lot of places, again, as Bill has talked about, are doing different things. They're doing different methods to try to catch infection walking in and reinfecting their facility. So places have daily infrared thermometer checks at point of entry. Some of them have daily questionnaires about where the person has been, who they've been, where they've been. Other places require both, and still others just require self-reporting on symptoms or lack of that or possible contacts. And again, what makes all of these all work is keeping attendance of who is walking into your facility. And that really is incredibly helpful for just being able to have useful information at your fingertips. And it helps you figure out who might be sick, who needs to be traced, and et cetera, and who might have been in a contact with an infected person. The temperature results and the questionnaires are all required to be kept in a confidential folder, either paper or digital. You're not supposed to be telling everyone else and the employees who's positive. They may find out by themselves, but that's not what you're supposed to be doing, and you're supposed to keep this stuff confidential. And also you should keep your daily attendance records. You don't have to keep them confidential, you have to keep them. The other thing, which also Bill talked about, is that organizations do have to have a plan for if an infected person does come in, or after a while being there during the day, it's clear that this person has symptoms of COVID-19. And you need to have a plan for that. This is not something you do on the fly. That should be that, again, a specific staffer is in charge of making sure that that person leaves the facility as soon as possible. And I would suggest that you have some kind of pre-arrangement to make sure that that person can get to his or her home, and or that if they need to get to a medical facility. And you should provide that assistance to that person, because it's probably one of your stakeholders, and why wouldn't you? The area where that person has been clearly has to be cleaned and then disinfected as soon as possible. A report should be written up on what happened on the incident. And then, among other things, you really have to contact your local public health office to give that office information on who was infected, what the symptoms were, where the person was sent, and then assist the office with whatever information you have on possible contactees so that they can start tracing who this infected person was in contact with. Next slide, please. Okay, the next one is basically focused on employees again, which is reasonable accommodation. One suggestion is that you could, while you're putting in your plan, but you're not there yet, send out a communication to all of your employees and all the rest of the stakeholders, asking if anyone, if they could self-report if they have a disability or a health issue which would make them more vulnerable to COVID-19. This will help your team that Bill talked about. It will give them a sense of what you need to plan an opening for your facility and continuing to have it be open. And clearly for different kinds of stakeholders, there will be different solutions. For your employees, which goes from rabbis and CEOs down to maintenance workers, et cetera, the request for the information needs to be done carefully because there is something called the Americans with Disabilities Act and the Age Discrimination Employment Act. So you can't presume that just because someone's older, you think you know what's wrong, what might be wrong with them, that you need to go talk to them individually. Let them come forward. Let them request that they need some assistance. And again, also under federal law, which was reiterated several times recently, that you can't bar employees from coming to work just because they're of their age or because of some kind of health condition. I felt taking that into consideration and writing that as part of your policy would be really good because it would set out what you want for your organization's culture for health, safety, and focusing on how to navigate through this crazy threat that we're all living through and that we're all in it together. The other thing to know about employee accommodations is that they're covered by federal, state, and city laws. They all envision that you're having a conversation, as you see in the slide, with the employee. And the major thing you should know is that sitting down and talking about an accommodation, you're talking about a reasonable accommodation and not just what an employee wants or insists that that's what they should get. The definition in this day and age of what a reasonable accommodation is in our current situation is that it reduces the exposure to COVID-19. Employers can ask for a medical opinion from an employee's doctor as part of the process so that there is a good assessment of the level of need by the employee and might help in what the best accommodation might be for that particular employee. This is all on a case-by-case basis. Also, you should all know that in the past there was something called employer hardship. And that if you could claim that you had an employer hardship, that the requested accommodation could be denied because it just was too hard for the employer. And according to everything that I've been listening and reading about, this is just not going to be dealt with by probably any court. It's just not going to happen, at least not now. So it's really, you have to sit down and try to figure out what's going to work for you and what's going to work for the employee. And also just for New York City employers, they specifically wrote up that you have to have a cooperative dialogue with the employee about the accommodation. And New York City requires that after you've had that conversation within 5 days, the employer has to give a written decision to the employee, and that's for that employee to have, and also clearly the employer should keep a copy of what the decision was. It doesn't matter whether it was positive or negative. And now I'm going to turn over to David Pollack, who will be covering special considerations. Next slide, please.
I actually, we're going to go to Bill Hayes, who's going to talk to us about safety and security first.
Oh, I didn't know that.
Yep, back with you guys just for a couple more minutes before we turn it over to David. And I just want to talk specifically about security in the current context. Next slide. As you consider reopening your facility, you want to be considering, in addition to health and safety, which we've talked about, maintaining security. Remember, the government or the state gives permission. Ultimately, the decision, though, is still yours, when and how you reopen. So security is in your wheelhouse in terms of decision making. So before you open, you want to make sure that you review your security plans, assess whatever risks and concerns that you have, determine your security staffing needs, making sure you have the resources you need, and of course, being vigilant to the ever-changing threat stream that's out there. Unfortunately, the security challenges that were there before COVID remain, and then there's new stuff that you have to worry about. So vigilance is the word of the day. Because of the COVID crisis, there are additional threats and vulnerabilities that have been identified. There are additional risks, and we've been really focused on the obvious danger, health and safety, trying not to get sick and treating those who are. There are other safety concerns. Up until the turmoil of the last few weeks, the civil unrest, crime in what I call the 3D world has actually been down because everybody's home, quarantined, locked down, businesses are closed. But online, extremist activity was off the hook. On steroids. There are those that would use the crisis to amplify their own message, and social media and the internet provide a platform to do so. And it can become very disconcerting and very confusing trying to keep track of what's accurate information and what's not. The ADL does a great job in documenting extremist activity. They have tracked and identified the increase in extremist activity, both online and unfortunately in the real world. And some of it is directed at the Jewish community. Fortunately, amidst all the violence, looting, civil unrest, there haven't been a lot of specific targeting of Jewish facilities, although there was a synagogue in LA that was vandalized with graffiti that contained hate messages. There was a shul in Richmond, Virginia that had a window smashed, and this is very concerning. Even here in the New York area in Westchester County, while not specifically targeted at Jewish institutions, there were two instances just since Memorial Day where public places have been spray painted with swastikas and anti-Semitic and also racist messages. So this bears close monitoring. It should be a concern for all of us. St. Patrick's Cathedral was targeted in New York City. So just because it hasn't happened yet, we shouldn't be complacent and think that it won't happen. A lot of elected officials are acknowledging that there are a lot of people out there trying to exercise their First Amendment privilege and demonstrate, and there are a lot of a minority, but a very active minority of folks that are trying to hijack that process and sow the seeds of anarchy. We have seen a lot of groups, left-wing, right-wing, militant extremists on both fringes, taking the opportunity to get their message out. And it's even more confusing, particularly in an online environment where you really don't know who is talking and the validity of that information. If you read the news, you saw that Twitter identified a group known as Patriot Front, a white supremacist organization, posing as Antifa and sending out messages that are contrary to Antifa's typical platform. So one extremist taking action against another extremist only muddies the waters further. So what this suggests is that there is the potential, as we go back out into the real world, for potential uptick in anti-Semitic acts, anti-Semitic incidents as reopening commences, as we reoccupy our buildings. So after having been closed for an extended time, we have to remember to keep these things in mind while we're focused on health safety. The cyberwhelm can easily translate or transfer into the real world. Simple things like getting the mail and screening packages may not be done in the way it was done before, because now you not only have to make sure those packages are safe to handle and contaminant free, but you have to make sure that those packages don't contain anything that's going to harm us or our congregants. So consider these risks that are posed by the new situation, incorporate those things into your planning, and think these things through before you reopen. Next slide, please. So, not to get too deep into the weeds, we could go on and talk about, drill very deeply down into a lot of sidebar conversations. This is where referring back to the JCRC document is very important, and of course, taking advantage of the regional security managers. Our guide gets very granular and gives you access to supporting documents and other resources. So I'm not going to get too much further into it, other than to remind you to take advantage of that opportunity. Here at CSI, we fielded a lot of good questions concerning how do we get visitors into a facility as quickly and safely as possible. If we're moving screening outside the building to do temperature checks, while it's always difficult to screen in prior cases for security to get people through, let's say, an airport or into a public venue, now we're doing temperature screening, maybe taking attendance. We're pushing that queue, that line, that gathering of people further out, and our perimeter is expanding. And so too then does the area of responsibility that we have to protect. So those things have to be considered. But think about it, post 9/11, aviation security went through a huge transformation. Things were changed, and we learned how to manage that process. So too will we learn how to manage this process. There are things that can be done to help safely comply with health concerns while maintaining physical security. Health screening. A couple of observations I've made. How will you do temperature checking? A lot of institutions have asked us, what about these remote screening devices where I can have a remote thermometer that will trigger if somebody has a fever? Well, someone still has to respond to that call. And we have found that it might be better to have an actual staff member or volunteer doing that temperature screening, because then they can immediately intervene. And it also, a live person also gives a level of security, and it tells your visitors that you care about their well-being. Watch out for scams. I learned within the past few days, a lot of these handheld thermometers are designed for food preparation. And if you read the fine print on the bottom of the package, it says not for human use. So don't get sold. This is a buyer beware environment. Don't get sold the bill of goods without making sure you know what you're getting and what you're spending money on. We want to try and minimize those delays at the door, and a physical restructuring of how your screening process works might be in order. Things like pre-screening attendees, pre-registering attendees could minimize the backups at the door. And it's going to be very, very locally driven based on the layout of your actual facility. Whatever you do, consider security as part of the overall package, and keeping everybody safe should be the overall intent, keeping them healthy, keeping them safe. A lot of organizations had folks working from home even before the stay-at-home orders. It's a new paradigm. It's new for a lot of organizations. Some have found that it works, or at least some sort of hybridized version of working from home and working in the physical environment. But if you're working from home, now you have to worry about internet security. Are your connections back to your servers secure? Are the physical devices you're using secure? Are you taking every step that you can to make sure that nobody can interrupt or damage your digital environment? A lot of scams and phishing attacks. This is a phishing, I mean unsafe email attachments that employees might click on. These things have increased, and they usually proliferate around some sort of triggering event. When the stimulus checks were given out, there were a lot of stimulus-related scams. Now that reopening is an issue, you may see scams that will offer to sell you personal protective equipment that either isn't up to snuff, or you may pay and the equipment is just never delivered. So make sure you're using known vendors, not somebody that just shows up out of nowhere with a super great price. Relationships with the local police are important. Before you open, consider notifying your local police department that you're ready to go. That way they're aware. In New York City, you have community affairs personnel, you have neighborhood coordination officers. they can give you a snapshot of what's been going on in that community, in your area. Have there been crimes? Has it been quiet? And also they can help you conduct a initial assessment of your facility and adjust patrols as necessary when you're going to be occupied. If you have difficulty coordinating with your local agency, that's what we're here for. In all of our geographic areas throughout the 8 counties that we cover, we have relationships with the local police departments. And it's very important to us that we help you strengthen those relationships. A lot of you already have very good, healthy relationships with local law enforcement. If that's not the case, though, please reach out to us on the side and we'll take care of that for you. So that's it for me right now. I'm going to hand off to David. He's going to get into specifics on your particular type of facility. And I appreciate your attention. If there's anything we can do, feel free to reach out.
Thanks so much, Bill. The Jewish community centers, the JCCs and Ys, have special considerations. They're probably the most complex of our institutions because on top of the normal issues relating to having a facility, being an organization, they have to also be concerned with childcare, seniors. They have pools and they have gyms, and there are special considerations for each. Before we move to the next slide, I just wanted to point out that in phase 1 and 2, we don't know what phase 4 is going to look like. There is the state is saying that the standard should be some sort of health checking and some sort of attendance taking. The health, but it can be done before someone arrives. So maybe consider putting a web page on your website, so someone can say, "I don't have any of the symptoms." You mimic what's in the requirements from New York State, and then your staff at the door can check whether someone has filled out all of the required health checking. Next slide, please. Okay, first, child care. It's very complex. I'm only going to hit the highlights here, but there is a CDC child care decision tool, which talks about, are you ready to reopen? You need the healthy hygiene practices. You have to have hand sanitizer everywhere. Employees should be wearing a cloth face covering as feasible. All of that is going to be standard. The intensification of cleaning, sanitation, and disinfection and ventilation that we spoke about. Social distancing will be the norm, but when you talk about childcare, I'm very practical. I don't know how much we can do social distancing. What we can do is to minimize exposure. You can keep groups together. Don't have different groups for Tuesday, and bring a kid in only Wednesday. You might have a limit on the number of kids in any group or pod. All of that is, to be considered, and stay tuned because things can change. You want to adjust activities, procedures to limit the sharing of items. Especially, you want to take away some items. Hard items of plastic can be sanitized. Soft items like dress-up clothes and things like that, soft toys cannot. So you don't want to have those toys around. You want to train everybody. And finally, the CDC recommends that everyone over the age of 2 wear a mask if they're within 6 feet of another person. I leave it to the terrific minds in our child care departments to figure out how you get children over the age, 2-year-olds to wear masks. I hear a lot of no's in my head, but that's what the CDC recommends. We have 2 links, one from the interim guidance for administrators from the CDC, and then the New York Times article from this weekend, which was very good. Next slide, please. Seniors. Okay, so seniors are, by definition, according to the CDC, at higher risk. So the first question is, should they be coming in whatsoever? And that's something that you're going to have to work out. I don't know if you can arbitrarily deny entry to seniors. You're going to have to talk to your legal counsel about that. But seniors should be, as much as possible, seniors should still be self-isolating to some extent. And, you know, there is a cost to isolation. So can you use Zoom breakout rooms to facilitate smaller group interactions or online exercise classes without the danger of gathering? I've seen some great examples from JCCs in our area. They're doing a great job online, and we need to continue to stimulate seniors and provide stimulating programs and online opportunities for socializing. Question: can you host mahjong or pinochle online? I'm not sure. It's happened. I've seen some sites, but that's going to be something very interesting. You have to arrange your furniture to encourage social distancing. So, you know, the question of how people are sitting you know, can you have seniors in masks having used sanitizer and playing cards 6 feet apart? Maybe, but as someone who wears hearing aids, I'm not exactly sure that that's going to be a very comfortable room with everyone shouting at one another at different tables 6 feet apart. Interesting challenge. You have to use hand sanitizer, and you know, you cannot eat while you're wearing a mask. So eat-in meals for the near term are going to be out, but you know, for preventive and protective services, can you provide shelf-stable, frozen, and grab-and-go meals or prepackaged snacks? You know, again, you don't want anything in a that's available to everyone and people sharing the same bowl, etc. Next slide, please. Pools. Okay. This is a capacity issue. We don't know what the capacity guidelines are going to be, but count on it. It's going to be less than they have been. Can you have kids just in the pool splashing? I'm not sure. We're going to see, but that's something to worry about. The shared objects. You don't want anyone sharing things that come in contact with the face. You don't want sharing of items, food, equipment, toys, supplies. You want to make sure that there's equipment or sufficient equipment. So if people use a kickboard or a pool noodle, you want to make sure that they don't just put it back, but someone has to wipe it down with the appropriate cleaning and disinfectant spray. And then this is really important. You'll need more staff because you have the lifeguards, but the lifeguards cannot be both lifeguards and the hall monitors who are going to monitor hand washing, cloth, face coverings, and social distance. You're going to have someone do both in order to be effective. And there's a really good CDC publication for public pools, and there's a link on the website here. Next slide, please. Gyms. Again, you're going to need staff to monitor this, but you have to schedule regular, deeper cleaning of exercise and changing areas. You have to wipe down lockers, not just the gym equipment, but the lockers before a new user enters. You want to make sure this illustration where the machines are right next to each other, really convenient, but they're not socially distanced. You want to unplug and mark machines that cannot be used. You want to calculate your effective capacity and use online booking systems. And then the question is going to be fairness. If someone can say, I've always had the 6 a.m. Reservation and I want this machine. You're going to have to figure out how to function with fewer machines, fewer slots in the pool, and how you're going to fairly allocate the prime time slots, and to move things around so that no one necessarily has a monopoly. And finally, for the immediate future, next slide. And now we're going to move into Q&A. We have about 20 minutes. And I want to introduce Adam Barish, who will be our Q&A person. I want you to know that this presentation is available at the link jcrcny.org/reopening. And if you have any questions or you want to contact your regional security manager, you can write to them at security.requests@jcrcny.org. Adam?
Hi, thank you, David. Right now, there are no questions in the queue, but if anybody has a question, please use the chat feature. You could send it to me, Adam Barish.
No questions? Everyone has this down pat.
Oh, wait, no, we do have one. I'm waiting for it to be.
Okay.
Someone just put that they had a question.
All right, David, I got a question in the interim.
Okay, Terry.
Maybe it will stimulate a little conversation.
Okay.
My video back on, I'm sorry. I was discussing this with Seth last night, and I didn't want to call you because it was getting late and we were all up late working on this. But I haven't seen the latest guidance from the government or the state as it relates to taking attendance or doing screening at JCCs. And I'm not talking about employees here. Obviously, employees are going to be subject to health screening. What's your perception or belief that the guidance might look like for people that are just coming to use the pool or other events that are going to be held at JCCs? Are they going to have to take attendance, do temperature checks and all that, just like employees?
Okay, so the question is, the answer is, I think that you're being warm and welcoming. Being warm and welcoming is protecting everyone who enters your doors. So it could be that someone calls in and you find out that someone was tested positive. You could have a contact tracer call your institution and say, Mr. Smith tested positive and he told us that he was at the JCC on the 10th. Who else was there? You should have an accurate answer. You should be maintaining either a sign-up list, a record of the swipes, who swiped in, what time, because Mr. Smith wasn't there from 7 in the morning to midnight. He was there between 1 and 3. So you want to be able to let a contact tracer know that Mr. Smith was here by 1 and 3, and the following people were in the building. And what's more is Mr. Smith was using the gym. So the people in childcare, the kids never came in contact with Mr. Smith. And that's really the optimal way that we're going to prevent infections and prevent super spreading of, because as we reopen, there will be more exposures. But the question is, how do we really protect everyone who comes into our door and make sure that everyone can, it will be as healthy as possible.
Hi, David. I have a few questions.
Good. Thank you, Adam.
Sure. This one's from Hulda Pierre, who works at headquarters at a Jewish agency. And we work in cubicles that are in close proximity to each other. The agency is having trouble finding ways to allow us back without exposure. What would you suggest? Cubicles, bathroom stalls, and elevators?
Okay. So we're going to talk about office settings on Friday, but a couple of ideas. Go to the guide, and in the guide that we have on the reopening page, jcrc.org/reopening, does have a appendix on the 6 feet office with all kinds of ideas. Do you use every other cubicle? Do you hang plastic sheeting from the ceiling between cubicles? Do you, I have a report from the building that JCRC is on. They only allow 2 people in the elevator at once because that maintains the social distancing. And then they have spacing set up in the lobby to make sure that people waiting for the elevator are at 6-foot intervals. And the question is, how many people can effectively work from home, which reduces the number, how many people are assigned to come in on Monday, Wednesday, Friday, how many on Tuesday, Thursday, and then you switch the next week. There are all kinds of creative ways to do it. We couldn't cover everything in an hour and a half, but there's a lot more in the guide, and the links in the guide are really helpful. Adam?
Thank you, David. John Wozniak asks, is there any chance for a list of recommended vendors for things like decals, masks, signage, etc., a list that can be accessed possibly on the JCRC-NY website?
We haven't been recommending vendors, but I find that it's really easy to Google, for signage. I know that, several sign vendors have been in touch with me, but we don't have the ability to vet them. So I recommend that you have a standard office supply vendor. That person will have everything that's available and give you a choice of objects. Anyone who does building supplies also is in this business.
Thank you.
And finally, on the reopening webpage, there is a link to a survey from UJA Federation. Do they have a buying cooperative? They're exploring the possibility of a buying cooperative. Go to that survey, fill it out, and tell them what you need. Also, the Westchester Jewish Council does have something for Westchester organizations.
Thank you, David. And last one was from Aaron Rosenfeld. Are we required to save all temperature readings and questionnaires daily?
Aaron, you're a lawyer. I can tell. I think that it's, as people enter, it's difficult to save the temperature checks, but if there is a requirement when we get to phase 4, and there may be, there should be symptom checking, and people can do symptom checking at home. What I would do is to have a dedicated web page on your website and have people say that I'm going to be there tomorrow between 9 and 12. And my temperature is fine, my appetite is fine. You go through the standard questions on health symptom checking, and then it's everything is in a spreadsheet, and you maintain that spreadsheet, because what you need to do is to the state contact tracers can use that information to help find potential further infections and nip it in the bud.
Okay, that's it for now.
And now I'm very pleased to present the wonderful president of the Jewish Community Relations Council, Cheryl Fishbein.
Thank you, David. Now I'm going to blush. We at JCRC are so proud of our team at CSI, the Community Security Initiative. Each one took a wide range of complex issues and made them understandable to all of us. The entire team, including each of our regional security managers, are available to answer your questions about reopening. Please also refer to our guide. And we owe a special thanks to UJF Federation of New York being such wonderful partners with us in this entire initiative. Abby Knopp was with us, Jill Mendelson is with us, and we thank you over and over again. Thank you so much. In addition, I'd like to remind you that our virtual parade, which had been postponed, is rescheduled for Sunday, June 21st at 1 p.m. We encourage all of you to come on in to our Zoom, to our postings of the parade, march in place and join us. It should be an amazing, wonderful, wonderful time. Again, Sunday, June 21st at 1 p.m. We wish you all safety and good health as you reopen all of your institutions. And again, we are there for you. Take care.